Hello friends, just giving you guys an update. I had some labs come in recently. So today is Wednesday, it is September 18th, so it is 1 week after my double mastectomy and left axillary dissection. So I'm still feeling really good. I feel like surgery went really well. The scars are really clean, and I'm not having any issues with scleromas or anything. So hopefully I won't have any issue with that. I'm trying really hard not to push it too hard. So I'm trying not to do too much, which is a hard thing for me. But my arm movement, I have more out of the right side, so I can kind of come up to like here where I probably wouldn't push it anymore. It just feels like the muscle does some weird things, and then this side, the left side, has got, far less, and I feel a lot of tightness there, so I'm not trying to push that too much. But the movement otherwise, I can kind of reach back a little bit better, and I can kind of pull up my own pants better now, so that's good. But it's hard for me still to put on like tops and kind of like get that on me. So still a lot of button ups. And I've got like the drains still. So I've got like the little drain grenades. Today I just put a holder on so that we can do the shirts that have the little built-in pockets. So we can do a little load of laundry. So I have those for next week. And it's possible next week when I go in and see LeBlanc on the 26th that I'll maybe get the drains out, which would be great. It is possible sooner, but I have to go 2 days under 20 cc's. They actually changed it a little bit. They wanted even less cc's, so 20 milliliters or cc's of fluid out of both sides total. So I have to be below that. So I'm not there yet. I'm still around 20 cc's each side, morning and night. So we'll probably have, I would imagine, the rest of this week to get through. But I've been able to take off some of the tape around it because I'm definitely having allergic reaction to the adhesive. So it's just super irritating, and it's like my skin on the top layer of my skin has been like wet or held something on too much, so it like is sloughing off and was really uncomfortable. So we went and got, Sarah and my mom ended up getting some paper tape and putting it. I actually said, let's put it on a silicone tube so it's not right on my skin, so I don't have any sticky stuff on me, and it's like the paper side of the tape on my tissue, and then that silicone thing has like a little barrier, and that seems to be really helping. So I think that's the best. That, or wrapping like an ace bandage around you, but it feels constantly like it's slipping down your body or something weird too, so you don't really want to have that. So I think the paper tape turned out, the sticky side out, is the best. I did get some really awesome updates. So just to give you an idea, I did get my breast MRI report back in, which is pretty straightforward for what I've been dealing with. So I'm not going to spend time on that one, but I did get my image. I just picked that up the other day. Their printer was down for a couple weeks, so I never got to see it before surgery, but I just picked it up, and I will be looking at that sometime this week. Just for fun, but I did get some great stuff in. So my Signatera test came in just last week or so, and the Signatera test is what you take to check your circulating tumor cells to see how much cancer is floating around your body actively at that moment. And the first one was, just under 200 cells. I forget how per millimole looks like, milliliter. It looks like that's how they're using it. So I was, just under 200, which is, it's just a number, but I had cancer. And then it dropped down in May. I was to 0.04, so that was a couple months in from chemo. And of course, I've been doing mistletoe through all this, but the numbers probably dropped due to chemo because it just kills things really well. And then I just got it back for August 28th, so 2 weeks after my last chemo. And it was 0.00, so that is Signatera test negative. Yeah, so that's super exciting. So it's cool to see, the graft on that, and it's just really just a, oh, look, it angles downward and it stays at 0. So that's super good news. Seems like that was great timing for surgery. And I also got my pathology report. So this is the exciting one that comes back after they check out your tissue sample and tell you what they cut up and found. Dr. LeBlanc called me last night. and I think she's always surprised when I answer. I seem and sound great. I feel and sound great, I guess. I sound great, I don't know, but I feel great. So other than the obvious stuff that you would expect you'd be dealing with from surgery, I'm not out there disc golfing yet or anything, but I am holding up well. So she called me and was really excited about the pathology report and just said, summed it up. And so, of course, I get to read all of the details, which are fairly good, but still, like, they never really figured out how many lymph nodes she removed, which is kind of a bummer because I really would like to know. But I'm going to guess at least 9. I'm not sure, but if they took a cluster of lymph nodes, I mean, those numbers can vary, but I'm going to assume at least about 9 were in that adipose tissue of scar tissue in that first cluster, probably up near the pec margin. I'm going to assume it was that one because that was where my sentinel node was enlarged. And so out of all of those lymph nodes, 2 of them sort of, I guess, looked suspicious, and they tested and they were negative. So everything in the lymph node area came back negative for cancer, which is great. Even the skin margins were negative. It said here that the surgical margins were widely negative. So that means she definitely got really good margins, which is, I think, what she was most worried about around the skin. So that's super exciting. I think the thing that surprised her and I was that the tumor had extensive necrosis and was ultimately totally just dead tissue. So they were saying it had a lot of necrosis. I'm trying not to get into all the technical stuff because there's a lot of terminology that can leave you confused, but that pretty much the tumor in and out was not histologically or cellularly distinguishable, which means I guess it was just a bunch of molted dead tissue. So that's like super good when you're dealing with cancer. You want a bunch of just like unrecognizable dead cells that can't do anything. So that's super exciting. And the odd thing is that there was only a small foci or focal portion of residual ductal carcinoma in situ, which means that there was a portion of, basically when it's in situ, it means it's still within the cell boundaries. So it's called ductal carcinoma, but it's not invasive ductal carcinoma yet, which is what the type of cancer I had was still invasive ductal carcinoma, which is the most common type of breast cancer. There are lobular and inflammatory and other types of breast cancer, but the invasive ductal carcinoma is really common. And a lot of women actually get these early tests now where they're getting diagnosed with ductal carcinoma in situ, which is almost like a stage 0, essentially. It's not moved out of that cell wall. So that's very interesting because that's all they found. They didn't find any cancer, which is really wild when you think about my tumor, which you may not know it as personal as I do, but it's just wild to me by, the diameter of the tumor tissue that they found, which was, overall cancer cellularity was 2%, which basically just says that like the cancer was just not present anymore, and that the cancer in situ disease, the percentage of cancer in situ was 100%. So all they could really find for cancer that didn't look like a good thing, but the beginnings of cancer was around the ducts, usually at the base of the nipple where the ducts are kind of exiting out. So it's like, that's awesome. I mean, yes, I'm still stage 4. They don't classify me now as stage 0, though that would be cool. They would just say spontaneous remission. Just, it's gone. The chemo worked or whatever. So that's super. I'm just really excited. That's super good news. And to me, how I'm taking it, and maybe it's not accurate, but I'm glad we got all that tissue out, even though it was dead tissue, because inside of myself, I felt as though the tumor was not completely dead. So I'm super happy to hear that we have had such a great effect on it, and that there was a very small likelihood that there were any other cancer cells being pushed out of that tissue that could be likely seeding somewhere else in my body. So that's super great when you're going into surgery to think, oh, okay, nothing's actually spreading its spores, essentially. Now's a great time to take out that necrotic tissue because your body still has to process that tissue, which is a lot on the immune system because it's having to clean out dead tissue, necrotic tissue, which is, pretty nasty. So what's that saying to me is that perhaps the chemo on the back end has changed enough cells on the other ducts, or that I was already in a suspicious cellular turnover rate that was already leading toward another bout of cancer, possibly in the duct, that they were able to get out before it really became anything nasty, which to me is like just another affirmation or validation to have had the surgery and just to get it out, and just to be done with it. So that's super exciting. They kind of messed up when they called Sarah. They had said they had taken out the left breast first and had only taken like an hour and a half or an hour. And then they moved on to the right side, and then it ended up being another like 2.5 hours. So they were worried for me. But I think they messed up when they called her which side they had done first. So on the pathology report, the right breast was removed first and was totally normal. Everything in that tissue looked great. They made comments that, the questionable lymph node on the right side, which was because of the mistletoe from previous imaging, they were worried about, but they left it. I told them, don't worry about it. They said everything inside looked great. They left everything. So that's awesome, but obviously took the whole breast. And then they did the left breast after. So they even write down like how long it took for them to remove it and when it was in the proper like formalin, which is like a preservative tissue, for them to have it sit there for 30 something hours. And then they did the dissection, that day and a half later, to see how the tissue histologically looks under microscope. So then they did the left side, which makes more sense because it took a lot more time for them, to remove my left side. So to me, that makes sense because you want to take off the normal tissue first to see what you're getting into with the not normal or abnormal tissue second. So kind of like what you should be looking for and what doesn't look right, So I think that makes sense. So I think it was just kind of confusing to my family because, of course, they're like, well, why did the other side take so long? But now I think it's all explained pretty well. So when they explain the left axillary tissue in here, they just say it was just a 5 by 4 by 2 centimeter portion of yellow lobulated adipose tissue. No overt lymph node candidates were identified grossly. And they separated these sections basically in 12 different, portions, 12 different cuts to check out these specimens. So they did not come up with a number of how many lymph nodes were removed. So there's the bummer. I will not know. I'll pick her brain a little bit more on what she suspects, but it's somewhere in that neighborhood, probably, hopefully under 10. But I don't know. I don't have lymphedema yet or anything. That stuff can take a while to set in. So today was my first PT appointment at Thrive, and they're very nice. She mostly just did measurements of my arms and wanted to see like how much swelling was already happening. And I've got the early stuff, like it's about 5% more swollen on the left than it is the right. So that's pretty good. That's super typical for this stage of the game. So we're gonna get, some cool arm sleeves and just anything to help reduce built up pressure in that arm, especially in these early stages. So hopefully we can prevent and if we have to reverse, but hopefully just prevent any lymphedema for down the road. So that's my update for today. I'm going to get ready to go for acupuncture, and then I have another hyperbaric chamber tomorrow. So I did a high dose vitamin C yesterday on Tuesday, which I don't love those. I just don't love them, but they're just annoying and caustic and kind of achy, and I just don't enjoy high dose vitamin C at all anymore. I used to like it. It was novelty then. Now it's just annoying. I don't feel well on it, but it's good for me. It's good to challenge the body because if there are any circulating cells that are displaced right now, they're very vulnerable right now. So you want to hit it with a higher dose of vitamin C, about a week after surgery or so. You don't want to do it too soon because the high amount of sodium in many of these bags can cause quite a lot of their own seromas and issues with fluid pockets. So we just did one yesterday. I'm still holding up really well, and tomorrow I'll just do the hyperbaric chamber because mostly I don't want to deal with another needle in me, and yeah, I'm just ready to just take a nap in a hyperbaric chamber. That'd be great. I'm still at an angle when I sleep, so I haven't gone to fully flat yet, and I'm feeling like I'm going to stay like that while I have drains in me. But I'm toying with the idea of going flat because it just feels like I need to lay flat again for my spine. But I'm still holding up pretty well. So I think I did a lot of good prep work with my Eldoas and all of my mobility training to make sure that my body was pretty limber going into this. So still holding up fairly well. We're going to go for a walk this evening. Trying to do a walk every day, and I did get some exercises, so I'm allowed to do some isometric stuff, pretty typical boring stuff, but this is stage 1 of rehab, so we all knew it was coming. So I'm going to do all those boring exercises, and hopefully I'll have more fun updates for you guys in the coming weeks. I hope you have a great day. Thanks for tuning in, and I'll catch you next time. Bye.